All right, boys and girls, this is Dr. Manish Chhabra, your ophthalmology educator at DAMS. Now, since past so many days, I have been receiving queries from students regarding ophthalmology as a branch, the pros and cons. So I thought, why not to make a small video which will help you choosing ophthalmology, right? And yes, many congratulations to all the students who have done pretty good in NEET PG 2024 exam, but some students who could not perform up to their expectations, don't worry, we are still to go with INI CT November session and NEET PG 2025. Have faith, don't worry, you are going to do well, right? Okay, now why to choose ophthalmology? Because of only one quality. What is that quality? That sheer awesomeness, right? I hope I am allowed to brag, a little bit about this branch, hai na? Okay, so of course, awesomeness and awesomeness. Now first let's deal with myths and facts, right? So I have been receiving queries from students, and most of the students would ask, sir, there's a lot of saturation in the field of ophthalmology, is it true or false? My dear friends, let me tell you, there's a saturation everywhere, but always remember one thing, that there is a vacancy on top. There's always a vacancy on top. If you are on top, you can be a pathologist, you can be an ophthalmologist, you can be an ENT specialist, you can be medicine, you can be surgery, any branch, you will always rise and shine, है ना? तो हम इससे compare नहीं करेंगे कि saturation है नहीं है. Even if you will set up a decent clinic in wherever, maybe in one corner of the city, or maybe in the periphery, or in the heart of the city, of course you will be having good number of patients. After some time you will not have, your OPD is full, जहाँ पे पैर रखने की जगह नहीं होगी in just 10 or 15 days. It takes time to build name, to build respect among the people in the society. So I would not agree with that. I would say that there's always a vacancy on top. So don't get carried away with this one myth if you are thinking of taking ophthalmology. And another thing which students ask me is, sir, it must be a hardcore branch with a lot of emergency cases. I always tell my students that this is both OPD and your OT branch. If you want to practice only OPD, you can cater to the patients of corneal ulcer, conjunctivitis, glaucoma, right? If you want to practice it only as OT branch, so what you do, you tie up with multiple hospitals, the peripheral centers, so they enroll optometrists at their end in their hospital. So the optometrist will filter out the cataract patients for you. You just go there, perform the surgeries, take the cut, and then come back, right? So I have seen many of my colleagues, many of the other ophthalmologists who are practicing like this. And OPD is like you can have your own small setup or large setup. It depends upon how much you want to invest. You can visit multiple hospitals. In the morning you can go to some hospital, in the afternoon you can go to other hospital, in the evening. Because see, I told you that ophthalmology is not an emergency branch, so you can always call the patients as per your own convenience, right? So that is one major merit of doing ophthalmology, right? While if you compare it with other branches which are surgical, so most of the other branches are either emergency branches, or if you want to go on for operating upon a patient, so the surgery time is pretty long. But in ophthalmology, if you want to perform the cataract surgery, in experienced hands, I have seen ophthalmologists performing phacoemulsification in as less as 5-6 minutes, right? So that kind of gives you a lot of confidence, है ना? You are confident enough, you are doing surgery in as less as 5, 6, 7 minutes, so you can cater to a large number of patients in a very short period of time. Like if you want to go for, if you are going somewhere for like just 2 or 3 hours, and in 2-3 hours you can easily do 10-12 cases like that, just like that, right? So yes, but yes, there are few emergencies in ophthalmology, which is trauma if there is laceration of the lid. But let me tell you, nowadays lid lacerations or such traumas are very well handled by cosmetic surgeons, right? MCH, plastic surgery, yes, but you can also handle it if you want to. And another is CRAO, central retinal arterial occlusion, if it is there. So there are very few such cases, yes. And let me also tell you that nowadays some ophthalmologists, they are even going on for practicing oculoplasty. You cater to the patients with entropion, ectropion ptosis. That is kind of conventional, but non-conventional is you even go for Botox injections. Botox, some centers, they have oculoplasty fellowship done ophthalmologists who are giving Botox injections. So that is also a plus point in case you don't want to go directly into much into surgical side, है ना? And yes, there are some students who would ask me, sir, there is a very long learning curve in ophthalmology surgeries. Yes, there is, but the long learning curve is for everybody, not only for you. If it is only for you, then there is a problem. If it is for everybody, like if you have spent like 5-6 good years in ophthalmology, now you can perform cataract surgery. Just like that, any fresh budding ophthalmologist will have to pass through the same process, spending 5 to 6 years. So that's okay. It takes time, buddy. It takes time. Yes. Okay. Next is, it is not an end branch. I always say to my students that of course there are fellowships. The fellowship options that you can have is cornea, cataract and refractive surgery. So this is one fellowship. Then we can have fellowship of glaucoma. You can have fellowship of vitreoretina. I'm just writing it down. Yes, you can have a fellowship of vitreoretina. You can have a fellowship of pediatric ophthalmology, ped ophthalmology. As I just mentioned, you can have oculoplastic fellowship, oculoplasty. You can have fellowship in neuro ophthalmology. Yes, so there are a lot of fellowships. So fellowships can be short term, fellowships can be long term. Yes, short term fellowships are usually 15 days, 30 days, 45 days, 3 months, while long term is 6 months, 9 months, 1 year, 18 months, 15 months, go up to 3 years. Yes, and fellowships, so even if you want to practice comprehensive ophthalmology, that is also fine. So you are well trained if you do your residency, and then you can work as senior resident in a government setup, or you can work in any charitable hospital for some time, and you'll be trained enough. Let me tell you, whatever fellowship you want to take, whatever fellowship you develop interest in, but most of the surgeons, they are satisfied while doing cataract surgery, because as I always say, cataract is just like playing a video game. It gives you immense satisfaction. You must have seen on Instagram where there is a caption saying very satisfying video to watch. Similarly, cataract is something which is very satisfying to do. Yes, so yes, so this is one thing. And if we further talk about fellowships, let me tell you, you will think, sir, 15 days fellowship, sir, 13 days. Yes, you go to a center who is operating on high volume. You go to a center, you pay some amount like 30, 50, 70,000 rupees. They are going to give you 30 surgeries. So you perform 30 surgeries under guidance after paying 50,000, 1 lakh rupees. So that is also not a big deal. You can always and always go for short term or mid term, medium term fellowships, है ना? So don't think that, sir, 15-day fellowship, what they are going to teach. So there are some centers who will charge, let's say, again I am repeating, 20-30,000 rupees for 15 days. They'll give you 10 cases. So you practice, and there are experts who are standing by your side who will handle any complication very, very cleanly and nicely, so that there is no effect on the visual prognosis on the patient. So don't think, sir, if I do complication, what will I do then? Some of you are thinking, I know some of you are thinking that you will be carrying a lot of guilt if this happens. Don't worry, no guilt will be there. There are experienced surgeons who will be standing next to you, and they will take over the case from you, and they will do it pretty nicely. Don't worry for that. So you can go for fellowships. Even if you don't want to go for fellowship, MS ophthalmology is itself a complete branch, right? Okay. Now, what is the satisfaction level in this branch? So imagine there is one patient. So there is one patient who is PL positive. Just in the morning, I am doing this from my OPD only. Just in the morning, I saw a patient who was having hypermature cataract, and he is PL positive. I have called the patient tomorrow. Okay, kal aana, operate kar denge. After surgery, even if the patient develops 6/36, I told you na, hypermature cataract, so I don't know the status of retina as of now. I have sent the patient for B scan ultrasound, yes, but anyway, if this patient even gets 6/36 of vision, the patient will be fully satisfied. And if the patient is fully satisfied, the doctor is automatically satisfied, hai na? So the satisfaction rate is very high. The patient is entering into the OT with a very less vision, PL positive, it can be finger counting, and is coming out of the OT with 6/6 or maybe 6/12, 6/9, 6/18, 6/36, है ना? So it is very, very satisfying. And I have myself seen patient. I'll tell you something very interesting. When I was doing my residency, so we have to do the evening round. We have to check whether everything in its place. If the patient is to be operated tomorrow, you go there, you check the saman of the patient, and then you give instructions, you write instructions, you interact with the patient, you interact with the attendants. So next following day, when the patient visits OT, the patient sees you, you are the face that the patient is seeing you every time, right? And I still remember when on the first post-op day, I opened the patch, the patient was 6/6, right? And the patient was so happy when I was doing residency. So the patient thought that, okay, this doctor is coming, this doctor has taken so much of care. When the patient was about to leave, that dear auntie ji, she opened her clutch bag and she picked up 500 rupees note and offered to me, ke doctor sahab, ye aapke liye hai, and you go and have something. This is the kind of the respect that patients have for ophthalmology, because just a day before she was having a vision of finger counting 3 meters, and now she is able to see everything clearly, right? Matlab just 2 दिन पहले the patient was like, मुझे कुछ नहीं दिख रहा माँ, मुझे कुछ नहीं दिख रहा, but now माँ मैं सब कुछ देख सकता हूँ, माँ मुझे सब कुछ clearly दिख रहा है. So it is very, very satisfying for you as an ophthalmologist, as a eye doctor. And if I would add to it a little bit, then there was one case, I operated a patient with trabeculectomy, and the patient had come from very far place, like 4-5 hours. He had come from Himachal Pradesh to Chandigarh, PGI, and he was a farmer by occupation. And the next following day, I operated the patient. I sent the patient home. He went home, and then when he got back the next following day, and he brought the fresh, what you call fresh spinach, the saag, के सर्दियों का मौसम है एंड घर पे आप साग बनाना, मैं सुबह सुबह स्पेशली उठ के आपके लिए फ्रेश साग लेके आया हूँ कि डॉक्टर साहब को देके जाना है, डॉक्टर साहब ने बहुत हमारा ध्यान रखा है. सो दिस काइंड ऑफ ब्रिंग्स योर सेटिस्फैक्शन लेवल टू दिस प्लेस, टू this place, and you feel really proud, है ना? You feel you are very thankful to the universe, that universe has chosen you to serve the patients, to treat their eye diseases, right? Okay. And there is another myth. Since it is a fine surgery branch, you are supposed to operate in just 3 to 4 mm of the depth. Remember, yes, 2 to 3, 3 to 4 mm with your instrument. So can an AI have an impact? I always teach to my students that there is a cataract surgery which is FLACS, femtolaser assisted cataract surgery. This is marketed as robotic surgery. This is marketed as robotic surgery, but that does not mean that the robot does it. Ultimately it is the doctor who is operating the machine. So there is no scope that any artificial intelligence can take over. So artificial intelligence can help in assisting the doctor, but it cannot take over the work of doctor. You have to remember this. And also I would want to add one more thing. So ophthalmology is one branch जिसका किसी और branch के साथ कुछ conflict नहीं होता. जैसे कि मैं आपको बताता हूँ, if the patient goes to a medicine doctor, right? So if the patient is having any difficulty in the eyes, the medicine doctor will always refer the patient to an ophthalmologist. If the general surgeon is seeing the patient and the patient says, Doctor Saab, there is something in my eyes, can you check this out? The doctor will refer it to ophthalmologist only. Even if you talk about OBGY, dermatology, ENT, so they will have to refer the patient to ophthalmologist only. So there is no, such kind of conflict. You will think your patients will go somewhere else. And also, even in today's time, especially in our country, where the patient goes to a chemist and takes the medication by himself, so nowadays, due to awareness, the patient, especially the patient who is having kind of eye disease, will not visit the chemist by himself. The patient would prefer going to an ophthalmologist in that case, right? Okay, all right. Now overlap with other specialties, it is a good thing. If the doctor is of internal medicine and the patient is having diabetes, hypertension, anyway the eyes are to be checked, because I always tell that it takes 5 years for the development of diabetic retinopathy in a diabetes patient. Now the patient has been recently diagnosed with type 2 diabetes, but the medicine doctor wants to know if it is an old diabetes for which the patient has been diagnosed now, or it is the new onset diabetes. So you get the fundus examination done. If you see dot blot hemorrhages, microaneurysm, or diabetic retinopathy changes, that means the patient was having diabetes since more than 5 years. But because there was chance diagnosis, so the internal medicine doctor can actually counsel the patient accordingly, because that the retinopathic changes, they are more dependent on the time period, not on the control. So the internal medicine doctor may have an idea since when the patient is having diabetes, right? Even pediatrics, ROP patient, even gynecology, gestational hypertension. So it is an overlap with other specialties. If we talk about orbital cellulitis, the ENT specialty, the medicine specialty, radiology specialty. So ophthalmology is one branch which is taking part in almost every branch, and helping them diagnose the diseases further. So that is also one plus point of ophthalmology के ophthalmology की जरूरत सबको पड़ेगी. Even internal medicine, even orthopedician, if the orthopedician is operating, if there is a case of fracture which has come and the patient complains of difficulty in vision, so the orthopedician will have to make a call to an ophthalmologist to check out for what? To check out for any personal retinopathy. Remember, if there is any small lipid droplet which kind of gets into the retinal arteries and may lead to loss of vision, you call it as personal retinopathy, small embolus. Yes, okay. So overlap with other specialties. And yes, some students are messaging me that, sir, if we want to set up a private practice, the cost is very high, sir. How to take ophthalmology in such scenario? My dear boys and girls, please understand that any private practice will have some cost, right? You are not going to open your private practice right after your residency. You will have some training now, hai na? What you can do is you can start with just your OPD. You just keep your basic equipment. I am showing you, check this out. So this is your auto ref, that is your slit lamp. You can just keep your basic equipment for a start, hai na? Just keep your basic equipment, the Snellen's chart, the refraction box, and and what you do is you can tie up with nearby eye hospitals that okay, I am going to come to your hospital, I am going to perform a surgery, I'm going to bring my own patient, so I can give you 10% or 20% of the total which I'll be taking from the patient, like this. Or you can do it, I am going to perform one surgery here, and for every surgery I'm going to pay you 5,000 rupees, but you will not interfere with what I'm taking from the patient. So this is kind of tie-up which is very common nowadays, since the OT setting cost, the phaco machine cost, the microscope cost is pretty high. So you tie up, so you don't need to kind of spend so much. But yes, for OPD basic infrastructure, so you will have to manage in any branch, let that be ophthalmology, let that be any branch, right? Okay, so let me tell you that by the time you will do private practice in your ophthalmology, don't worry, you will have enough enough finances to set up your own decent OPD, so don't worry for that, right? Okay, so that was it from my side. I hope I have cleared many of your doubts, and in case you still have any doubts, you can get back to me. So I am sharing my WhatsApp number 9814111330. You can also message me on Instagram, that is I_Manish, or you can also follow me on Telegram. The handle name is DAMS Ophthalmology Academics. DAMS Ophthalmology Academics, है ना? You can search me. I am writing it here because there will be overlap with my video. DAMS Ophthalmology. So this is my handle, Ophthalmology Academics, right? All right, so it was a pleasure, right? And any doubts, you are most welcome. And yes, welcome to Ophthalmology clan. And if you get a seat in and around Chandigarh or maybe in Punjab, you are most welcome to visit me. And even after doing your residency, if you would want to learn a little bit of ophthalmology, the surgeries, the glaucomas, whatever, and I am always here for you. Just be in touch, let's stay in touch. And also, yes, let me also tell you that we are having our ophthalmology resident course on eMedicos app as well. So once you enroll in your ophthalmology JR-ship, you can always take the eMedicos course, which will give you basic understanding how to proceed, in which I have shown my real patients. I have kind of covered a lot of theory to assist you in your difficult times in your residency. Let me tell you, you will not be having difficult times in your ophthalmology residency, first of all, because ophthalmology is a very light branch. You will enjoy living the resident life. Difficult times I meant is starting with whenever we enter into any JR-ship, so we find difficult to cope up with what's happening now. So with respect to that, so I am here to help you. And yes, again, it was a pleasure. Thank you so much. I hope to see you soon. Bye bye, and take care.